Ceann Comhairle, or Cathaoirleach. Last week, Minister, I asked if we could find a mechanism to pay our radiography students. And this was in the same way you found a mechanism to pay our nursing students, given that they're putting themselves and their families at risk by working. And you told me that you would ask your department to come forward with proposals for other students usefully working in the health service and whom we need. I hope to bottom that out before we meet here again. So we meet here again, and I'm here for an answer, not for me, but for the radiography students who are wondering when are they going to get paid. Also last week, I asked you about extending the power to prescribe to optometrists, and you told me you would speak to your department and you would revert to me directly. I don't want this speech to be too accusatory, but you know, there's a pattern to this, right? The COVID queries system, which replaces Dáil questions. Obviously, we can't put down Dáil questions, so I'm putting down these COVID queries, and I haven't had an answer. Queries that I put down last week, we've passed by the deadline. I've had answers from all the other departments, but not from your department. So clearly there's something not working. Maybe other deputies could say whether that's happened with them as well. I haven't had answers on the COVID queries from health, and I shouldn't have to bring them in here and put them all to you. Also last week you said you would update this House on progress with the mobile app, which is obviously key to being able to relax restrictions. Information that I've had about this mobile app has been very scarce, and I had to read in the newspaper this week that it's going to be a decentralised app instead of a centralised app. You suggested that I bring this up with the HSE, with the weekly meeting with the health spokespeople, which I did with Deputy Shorthole here, and I was promised by an HSE director that they would supply me with a copy of the specification, so I'm looking forward to getting that. Ireland is one. If we're going to go for a decentralised model, I welcome that, because there are only 2 countries in Europe, I understand, that are insisting that their health authorities should be able to see the data that's provided by these contact tracing apps. And there is a real risk if we tell people that we're going to spy on them, or that the health authorities are going to see all their data, that they won't buy into this and they won't use the contact tracing app. You've mentioned that it's important, Minister, you've said that it's important that we're all in this together and that we pool our resources and work together. And yet we're not having an open discussion about the app. I'm asking questions, I'm asking basic things about the specification, and I'm not being supplied with any information. So I'm just going to boil down my question to this. Will you commit that before you launch the app that you will publish the data protection impact assessment, and also that you will publish the technical specifications? And that's before launch. The lockdown measures are due to expire on the 5th of May, as I understand it, and we're just a few days before that, and there is very little information about what's going to happen. It's very hard for people to plan in that situation. And I listened to what you're saying today about that. We don't know what the criteria are going to be to relax the restrictions. We don't know what different phases there are. We don't know what the different, we don't know how these different variables that are involved, what the different metrics are, and how they interact to make that decision. So, you've talked about getting the R0 down below 1, and that's great. But how about other variables like the death rate, the admissions to acute hospital, the admissions to ICU? How do all those things interact? And that interaction of different variables is a model, and I understand that Professor Nolan is working on this model with NEFIT, and yet, after weeks and weeks of asking, and Deputy Stephen Donnelly has also asked for this, we still don't have sight of the model. And because we can't see the model, because it hasn't been published, we don't know the mechanism by which the decisions are being made. You, as Minister, point to NEFIT, and it's a black box, and say this is medicine and science in this room, and they make decisions based on various variables that interact in a way that can't be revealed to anybody, and as a result of that, the public are looking on, and a lot of the public would love to be able to scrutinise this. We're the deputies here. We should be able to ask questions and say, why is this happening? And it would be actually useful if we did work together, and if we were all in this together, and we could scrutinise and see the decisions, and that could create greater buy-in from the public and from all of us into these very difficult restrictions that are being made, or the decision not to relax restrictions, as it may be. And I think that there are, in Europe, I think our European neighbours are taking a much more open approach to this than we are. COVID testing. I'm not going to go into all the testing that other deputies have, but I will say that I want to ask about the Irish Blood Transfusion Service and blood donation. I understand that's still going on. I'd ask you to encourage people, or to publicise the fact that you can still give blood. It is a reason to leave your house and to do something. A lot of people have a great need to contribute something, or to feel that they're doing something for the cause. People can donate blood. And I would ask you if you can investigate whether we should be screening those blood donations for COVID antibodies, and whether that would provide more information into the system to know the extent of the spread of the disease and how we're getting on with it. The therapeutics, drugs to deal with COVID-19 are an important milestone in the journey to the roadmap to get out of these restrictions because of this disease. Now, I understand that there is a very promising drug, remdesivir by Gilead, and that they're working on this, and I understand that Gilead have extensive production facilities within this country. I'm worried, Minister, that just in the same way that PPE became a huge block, became a stumbling block for us to make progress with this disease, I'm worried that the production of these antiviral drugs will also cause a slowdown, or will also be a blocking point for us to make progress. And I'm asking you, what measures will you take to plan for the manufacture of these therapeutics in the Irish system? I won't ask about face masks because my Sinn Féin colleague has asked this already. But I will mention that the European Centre for Disease Control has shifted position and has published differing advice, that it has changed in different countries, that Germany is telling their citizens to wear face masks in public. And I feel sorry for people who are working in positions, for example, if you're at a checkout and you have hundreds of customers going past you all day, I think that those customers should be wearing masks so they don't cough on you. I think this is something that I would like you to make a change in policy, and people will forgive you for having a different position earlier on. Public parks are still open, and they're really important that people have somewhere to go and that they don't have to pay for it, and it's something when they have a restriction in the number of things they can do. But private landscapers are not allowed to work. So public parks have been designated as essential works, and the workers who work in them, but people who work in private parks cannot, and there are many housing estates that have parks and they can't use them. They've been locked up, they've been chained up for months because they haven't been taken in charge. And I'd ask you to at least, and I don't want you to make no changes next week, I would love if you could make an executive order that allows people who are private landscapers, gardeners, with sufficient precautions to be able to work and to reopen these private parks. Thank you very much.
Any questions not being answered, I'd like to follow that up with you directly and ensure that that is not the case. I obviously met your party leader for 2 hours yesterday with the Taoiseach, and we do that generally once a week. Obviously we have the HSE briefing, and we have 2 hours of questions and statements in this House, and we have a daily press conference with the Chief Medical Officer to update the public, but I'm very, very eager that the information flows. On the student radiographers, I did say I'd try and sort it out before we got here. There's about 55 of them, I believe. We've been looking for that mechanism. Student nurses did not get paid for being student nurses, let me be clear. Student nurses got offered the opportunity to be employed as healthcare assistants and be paid for that, and many thousands of them have taken us up on that. I have a proposal that we would offer student radiographers the opportunity to be employed as assistant radiographers, and I've asked that my department and the HSE would meet SIPTU on that as a representative body. So that's the proposal I'd like to put forward. My department and the HSE will engage with SIPTU if they haven't already commenced that engagement. I have an 11-page note on the mobile app because I knew you were going to ask me, and I did say I'd update you on it. I think in the interest of time I'll have to share it with you, but I'll share it with you and any member of this House now. We want to get this right. This will only work if there's public buy-in, and I do give a commitment to coming back to this House prior to launch to take any questions and to publish any information that is relevant and helpful. This will only work if the people of Ireland download it, buy into it. Otherwise, it'll just be something nice that people will get a launch out of. It won't make a blind bit of difference. So we need the buy-in from people. Look, in relation to the criteria, I take the point you make, but I mean, I think the criteria in relation to the easing of restrictions has now been pretty clearly articulated by the Chief Medical Officer. We need to see ICU admissions lower than they are, right? So there were 70 people in ICU with COVID-19 when we brought in the current restrictions. There's still 103 today. So despite the progress, there's still more people in ICU now than when the Chief Medical Officer thought it necessary to advise the government to lock down. There were 160 people in hospital with COVID-19 now. There's still, on average, around 700 people. We had about 200 cases a day on average then. We're still having that and more now. So the behaviour of the disease is still not where we need it to be. And so it's not one metric, obviously, as you rightly say. There is a number of things that we're looking at. In relation to the issue of blood transfusion, I absolutely take your opportunity to encourage people to donate blood, to give blood. It is, as you say, a reason to get out of the house, but it's also a really good and life-saving thing to do. And on the issue of face masks, there'll be no pride here. If the evidence changes and our experts believe it should be done, it will be done. I believe they're going to look at it again tomorrow. They've already changed their advice, as you know, in relation to healthcare professionals based on international expertise. A number of countries have changed their view on face masks or face coverings for the population at large. And I think it's likely that that's going to happen here, at least in certain circumstances. An advisory would be issued or guidance would be issued. I don't envisage us making the wearing of face masks mandatory, but that advice and guidance would be given so people can make informed decisions.